After your operation, you will return to the ward. The team of ward nurses and physiotherapists are experts in helping patients recover from surgery, get moving and safely discharged home. To help with your recovery, there is a guide to what you should expect to be achieving each day after surgery in your patient information booklet. Please use this each day to chart your success and prepare for discharge. There is a lot of evidence that getting up and moving as soon as possible after surgery leads to a quicker recovery. It's normal to feel anxious about getting out of bed for the first time after a joint replacement. A physiotherapist or a nurse will assist you to get out of bed at the earliest opportunity that it is safe to do so. Some of you will be able to get out of bed on the day of your operation. For others, this will be achieved the morning after your surgery. The physiotherapist will encourage you to walk and assess the best walking aid for you to use and teach you how to use it safely. You should try to walk a little further each day, as walking is key to your recovery. If you need to be able to walk up and down stairs to get into your home or access your bedroom, the physiotherapist will teach you how to do this before you go home. To go up the stairs, place your unoperated leg onto the step first, push on your hands and bring the operated leg onto the same step. Repeat this all the way down. A physiotherapist will teach you exercises to maintain your circulation, strengthen the muscles and get your new joint moving. It's important that you complete these exercises regularly throughout the day. Little and often is best. Many of these exercises can be started before you come into hospital. Swelling following your surgery is normal. To help manage this, it is important to ensure that you keep your new joint moving and also have periods of rest with the leg raised. Ice packs can also help to reduce the swelling. The therapist on the ward will assess your sensation and provide advice on the use of ice. If you have a knee joint replacement, it is important to work on both the bending and straightening of your knee. Most people are able to achieve a bend close to 90 degrees before discharge from hospital. Remember, do not let your knee stay in one position for too long, as it can feel stiff and painful to get it moving again. If you have had a hip replacement, you can move your hip joint freely within comfort, unless you have been advised to do so by your surgical team or therapist. Hip movement should be controlled, avoiding sudden or extreme positions that can cause pain. The aim of surgery is to improve your movement and quality of life. You'll be ready for discharge when you can walk safely with an appropriate walking aid, are independent with your home exercise program, your new joint is moving well, you can go up and down stairs safely if required for discharge, you can manage daily tasks independently or have someone who can provide help at home. The ward therapist will discuss follow-up physio with you and arrange this to you before you go home. When you get home, you will need to continue with the exercises on a daily basis for several weeks. This will help you to continue to strengthen the muscles around your newly replaced hip or knee joint and improve the movement in the joint. Do continue to increase the amount of walking you do on a daily basis. If you progress onto one crutch or stick, you should hold it in the opposite hand to your operated leg. Once you can walk without a limp, you may stop using your walking aid unless you have been advised to do otherwise. Many patients in hospital are active only a few minutes each day. At RNOH, you have access to a team of highly skilled physiotherapists who will help you to be active. They will advise you on exercises, provide a rehabilitation program, and encourage you to exercise, help you to move around or walk after surgery if you need support or assistance, provide you with an appropriate walking aid and teach you how to use it. To help yourself, you can ensure you regularly take your pain relief and ask for extra if required. Keep changing your position, whether you are in bed or sat in a chair. Do your prescribed exercises on your own, either on the bed or in a chair, with guidance from your exercise sheet or staff. Sit out of bed as soon as possible after surgery and as often as possible. Walk around the ward when safe to do so. You will be advised on continuing your exercises and progressing your walking. Most patients benefit from continuing physiotherapy, and if required, a referral will be made to an appropriate local service.